Aloha, and how you doing? Welcome to Hibachi Talk. Another exciting 45 minutes here in beautiful downtown Honolulu or at the beach. Anyway, grab yourself a libation, pull up a stool, sit down and join us. I have my good old buddy, Papi Chulo in the house. Papi Chulo in the house.
Aloha.
What does that mean again?
Hello?
No, pretty daddy, not hello. Hello.
I think he said aloha.
Aloha, yeah. So Papi Chulo's in the house. Mr. Lanning is off traveling the world again. Again. He's got more miles on his plane than Donald Trump does. I tell you, just he's flying.
I should charge him for having me cover him.
Well, you know what? He'll give you 50% of what he gets paid for this show.
All right. I'm ahead of the game already.
Half a zero is zero. Anyway, we have a great guest today. We have a great a fellow by the name of Thomas Kniss, and Thomas is is with a company called Presidio, and they're a large full-service IT organization, and we'll talk a little bit about that. He specializes in the healthcare field, so he's one of their VPs and senior execs over there. So it's going to be kind of fun to have him on the show and talk about all the great stuff that's been going on in healthcare now and in the future.
We need that.
We definitely need that. So
healthcare, not Thomas.
Yeah,
Healthcare,
right.
Quality healthcare.
But
if he gets it there to be quality, then so be it.
That's how it will be. And then I got some news. You know, I'll do a little bit of news.
Again?
Yeah, I always do. Hey, this is a full-service show, dude. You know,
All
it's
right.
like, sitting there. You're always tidying up. Do we not do a good enough job?
I'm a germaphobe.
Oh, good thing it's about healthcare. So so we have usually Andrew Lanning coined this phrase one day. We were here doing the show, and he said, when we do the shows about something, we keep all the themes the same. Mm-hmm. So we did Cinco de Mayo. We talked about
the heritage and the reasoning
and the reason why it was named Cinco de Mayo.
And the misconceptions.
The misconceptions, so thematic.
Yeah.
So, but today we're going to do some little news on healthcare. But first, we got to do Got One Tech Job.
Oh, that's
which is one of my favorites. So I got this one sent to me today. It says, not today, or a couple of days ago, Got One Tech Job. I used up all my sick days, so I called in dead.
That works.
Have you ever had employees that used up all their sick days?
Yes, as we speak, we guys got snake eyes across the board. No sick leave, no military leave, no annual leave, no nothing. Can I change my days off? I said, sorry, buddy.
Can you change your days off? They're already all off.
Welcome to the real world.
I tell you, and my purpose of that is if you're in the tech business, there is no days off. I mean, you're just constantly working. Anyway, I love it. I used up my sick days. Anyway, so I got a little bit of news. First one, though, is not thematic. It's not about healthcare.
It's the good news, though.
I don't know. It depends on who you are. My former boss.
Oh, geez. Okay.
My former boss.
Which one?
Peter Carlisle.
Okay.
He announced this morning that he's going to be running for mayor.
I saw that.
Right? So Peter announced this morning on KHON Channel 2 that he is going to be running for mayor. So he served as mayor through 2010 and 2012. That was my last 2 years in public service.
And look at you now.
And look at me now. Still no further ahead. So that was my 2 years at sitting and counting. Anyway, so he's gonna
silly and clowning.
Silly and clowning. Oh, I never thought of that one. I've used that one. So he's gonna be running. It was interesting because when he ran before, it was Ben Cayetano on the anti-rail platform, and no pun intended. And then we have Kurt Caldwell, and then we had Peter. Peter finished third, so it'll be interesting. And he was the incumbent. It was interesting. So anyway, it's going to be interesting to see because as I read the news and so on, Mr. Caldwell has a fair war chest. He has quite a bit of money. So we'll see.
Wow, interesting.
So anyway, hang on to your wallets. Here we go again. Okay, so now we're going to bounce over and get into some technology-related stuff in healthcare.
Okay, here's where you lose me.
No, here's a question for you, though.
Oh.
Okay, so medical robots. Okay.
Wow.
So medical robots. There's a lot of robots get used in surgeries.
I heard the latest and greatest back in the day was the Da Vinci guy. That thing the surgeons used, the Da Vinci robot.
Robot.
I hear that was a good thing.
So how long do you? So you're leading up to my first question to you. So how long ago do you think the first robot surgery took place? How long ago you think?
Well, I would probably go as far as say maybe in the 60s.
30 years. You're right in there, right? So it was 30 years ago they were using robots back
Thank God for that, because I would have a big gash across my stomach if I didn't have the robotics for gallbladder surgery.
Oh yeah, you had one of those?
Yeah, we only had ping, 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 3 little minor pukas.
And seeing the size of your stomach, that'd be one hell of a gash.
Yeah.
They would have had to ship in sutures.
Yeah. Or a lot of cats to make a cat gut.
A lot of cat gut, right? Anyway, so 1985. So you were close. 1985 was when they did it. So robotics have been used in there. So and as you know, my lovely bride is a OR nurse, and she does a lot of work with robots.
Well, she lives with you.
Well, that's true. I know. I don't understand why she can put up with me. Anyway, so it's again continuing to look at it going to be a wave of the future as more robotic surgeries are performed, less invasive surgeries. I mean, I've had multiple knee surgeries, and they're not.
But you only got 2 knees.
I know. Well, they had to go in a couple times, and it's a long way different from the first times when they used to cut you wide open. So kind of cool stuff.
Yeah.
So then we're going to we usually have Mr. Lanning usually has this thing on security, his security moment. And I know you're in security, but you can't talk about your security stuff without someone getting killed. So how many percent of the healthcare entities, now entities can be hospitals, doctors, groups, and so on, do you think have had cybersecurity breaches? What percentage do you think in this country?
I would say maybe 50%.
How about 89?
Ooh, I was being generous.
I know. Nearly 90% of healthcare organizations have experienced data breaches.
Wow.
So Thomas is going to be able to talk about some of the things that that could happen to if someone was to use someone like Presidio to help them with their security layers and things like that to protect. But almost 90% for the second year in a row, criminal attacks are leading the cause of breaches. Criminal attacks. So we've talked about this healthcare record. Right now is worth about $50, I think. And I'll ask Thomas if he can confirm that for us. But a healthcare record is worth about $50 on the black market. And
who the hell wants to know about my stuff?
Oh, think of it. What's in there though?
Or what your stuff?
Think what's in there though. You got your name, your wife, your children, your social security number, all your medical records. Your medical records, which may have something in there that you don't want public, all those kinds of things that are sitting in there.
True.
And then they get access to your families as well because all your mother and father's information's in there, all that kind of stuff. So it's worth quite a bit of money. So, and credit cards like a nickel or $5 or something like that. So they're just trying to show the difference. So big, huge, 50% of the data breaches in healthcare in 2016 are caused by criminal attacks. So your 50% was right from a criminal English as she is spoken, from a criminal perspective.
Criminal.
Yeah. I've been trying to learn Spanish so much now I can't speak English.
You're a cunning linguist.
There you go. Anyway, and then the other 50% are unintended employee challenges where they've gone and made mistakes, stood up servers when they shouldn't, opened up ports when they shouldn't, all of those kinds of things. So anyway, it's something else. So that's one of the things that's happened. So one of the other things we've been talking about is that, the fact that a lot of medical providers don't share their data. They keep it to themselves. And we talked with a Thomas and I were meeting with a local company today, healthcare provider that really adopts that philosophy of sharing the data from all the doctors and from the clinical providers and all of those kinds of things. Very big on it.
Funny you should say that because me being in the federal system, we have to have our annual physicals, but to be cleared for duty, they got to deal with my private primary caregiver.
Okay.
So they don't communicate unless I force them to communicate, or else I'll be out of a job.
Yeah. So they have to pass paper back and forth.
And they don't do it unless you force them to do it because I'll be out of a job.
You'll be out of a job. So there's a lot of that happens. So there's the guy that heads up the acting director of CMS, which I think is the something Medicaid, Medicare organization. So he heads up this organization. His name is Andy Slavitt. He says it's time to stop doing the silos with the data, and they really need to force the sharing of the data across all of the different entities. So it doesn't matter whether you went to Queens or Straub or Kaiser or any or even a clinic or whatever, that data should be shared across all of those different healthcare providers.
Bottom line is quality care for the patient.
Exactly.
As long as you get paid, who cares?
Yeah, and that's kind of, you're just see, and that the public has a hard time, a hard time grasping why it just doesn't happen, right? Why did they not do it?
I believe it's all the bureaucrats up at the higher levels.
Well, it's the insurance carriers and what they've got to deal with, and things like that. So there's a lot of
proprietary.
Proprietary. But this siloing has to stop. It really, really has to stop.
Yes.
And so there's like I said, today I met with someone who was very much in that boat. I have a client that do a lot of work in the elderly care. That their core that they're building is the sharing of all of this data, and they're going to be the clearinghouse for all of that core. So they're in town. At least you can say in town there are two individuals, high executives that really get it and are really pushing for that to happen.
As long as they get it, that's all that matters.
And now it's a matter of making it happen. So that's kind of a cool thing. So,
but on that same note, you know what I saw in the paper is our representative, Susie Chun, who's gracefully bowing out after many years of supporting all the efforts in town.
Susan Chung, Oakland?
Yeah, Oakland, yeah. I knew her back in Lehigh, back when I was living there.
Yeah.
And she's a champion for all the good things that Hawaii needs.
Yep.
Homeless, the seniors, all the benefits that everybody needs.
Right. Yeah. And so, this is something that we'll be pushing. So then there's this organization called NIST, the National Institute of Standards and Technology.
Okay. I didn't know there was one.
Yeah, well, they've been around for a little while, and they created a national security framework that came out in December of last year, or last quarter of last year. Ron Ross, who is part of that organization, has come out with a document that identifies what you can do to solve 90% of those cyber type attacks that were happening. So so people ask, they say, well, how do I do this? What do I have to do? Well, now there's documents that will tell you policies, procedures, technologies, not specific vendor technologies, but the types of technologies that you need to use to secure your data from the attacks that I talked about in the earlier newscast, part of the newscast. So basic blocking and tackling of cybersecurity. Healthcare organizations get in there. Cybersecurity could not be more important now. It's like at the top of the list. As a matter of fact, in June, I'm doing a presentation to the Hawaii Association of CPAs. And we're going to talk about cybersecurity and what's happening in those spaces. What can they do for their clients? Because it's touching everybody's
money, financial.
Yeah, you've got everybody's financial information on there, and though their businesses have to be secured, as well as what they need to put in place and such. So, and the cloud does a lot of great things like that, and Presidio has a really interesting partnership with a company called Sequoia that does cloud offerings, and that's a kind of a I should say cloud offerings, but they do cloud management. So, because it's a very complicated process, but now there's people that are getting into the industry to help the small businesses and those kinds of things say, well, what is cloud, and how can you help me get to what I should get to? And so there's entities out there doing that now. So kind of cool. So then the other one, I'll talk about public health information, PHI. We got a Ohio Mental Health Addiction Services Agency disclosed 59,000 patient records. Wow. So this is a mental health agency. You know how they did it? This is and I see it happening. It's so simple. They mailed out flyers. They put postcards and mailed out postcards. And because they mailed out the postcards, that information then knew that the postal carrier or whoever then knew that this person was at one point in time at that mental health institution. That is the disclosure of public health information. A simple thing. So everybody thinks the technology side. So that's one of them. Simple. Anyway, that's kind of like my news for the day. We've rolled up in the first 15 minutes. We go get our guest Thomas Kniss, and we'll talk further about healthcare. We'll go get Angus off the beach. He's got a gadget, and Scottish word of the day. You're batting 1,000 right now, so we'll see what that is. Anyway, we'll be back in about a minute.
Aloha, this is Maria Mera, and I'm here to invite you to my bilingual show, Viva Hawaii on Think Tech Hawaii, every other Monday at 3 p.m. We're here to inform, motivate, and entertain you. Join us. Hola, soy María Mera y estoy aquí para invitaros a mi show bilingüe Viva Hawaii en Think Tech Hawaii cada 2 lunes a las 3 de la tarde. Estamos aquí para informaros, motivaros y entreteneros. Apuntaros.
Aloha, my name is Richard Emery, host of Condo Insider. More than a third of Hawaii's population live in some form of association, and our show is all about educating board members and owners about their responsibilities and obligations and providing solutions for a great association. You can watch me live on Thursdays, 3 p.m. to 4 p.m. each week. Aloha.
Aloha and welcome to Think Tech Hawaii. I am Ina Chang. I am the guest host for Small Business Hawaii with Reg Baker. Tune in every Thursday at 2 p.m. and watch us. Aloha.
Aloha, my name is Justine Espiritu, and I am the co-host of Hawaii Farmers Series. This is my co-host, Matthew Johnson, and we are live with you every Thursday at 4 p.m. at thinktechhawaii.com. And our show focuses on Hawaii's local food community. We feature not only the farmers that are producing our food, but we also feature the supporters and other folks involved in the community that are trying to promote local agriculture.
Hey, Angus, what's going on? What's happening? Long time no see.
Hey, Papi Chulo! How you doing there, Rod?
Awesome.
Good to see you! I'm trying to use my Spanish accent with the Scottish accent. It didn't work, lad. It didn't work. Anyway, it's good to see you again.
Right
Like
here.
I always say, buenos nachos.
All right.
Terrific. Anyway, we got a wee gadget, but you know what? We did the Scottish word of the week, and the last time you got it correct. So we're
Right
going to
now.
try it one more time. So here we go. Here's we got the Scottish word of the week, but it's a phrase. Had your weast. So had your weast. So it means one of these 3 things there,
Oh,
lad.
I got it already.
It
So
it
easy.
could be quiet, or it could mean stop your whistling, or it could be get your wish. So what do you think it is that had your weast?
A, B, C. Answer is C.
Wrong. You didn't get this thing. Had your weast means be quiet, like weast, lad. Shut up, weast.
Oh.
Which you need to do a few times, just so you know. You got that rubber lip going all the time. Anyway, so that your Scottish word, so now you're down to 500. We'll see what you're like next time. Anyway, I got a wee gadget. You know, they're putting air conditioning in the schools.
Cool.
Yeah, and you know,
Cool.
Gordon, you're cool. Yeah, well, very good. So anyway, but I found this wee personal air conditioner system. You can buy it online. It's a wee little mini handheld AC unit. You get it from Japan. It's really cool. You put a little sponge with cold water in it, and it turns on a fan, and it blows the cold air from the sponge on your wee face. Kind of
Wow.
neat. It's less than $10. But then you got the school air conditioning systems. We're going to replace this with the other stuff at the schools later on. You know, this is what they had before, and they had another one too. I think we got another picture with their other air conditioning system. Yeah, then they had this one before, which ice cubes in the middle of the classroom. But now we're going to get real air conditionings in the schools.
Where's the shave ice
So,
machine?
oh, I never thought of that, lad. We could have sold shave ice. Anyway, that's my gadget for today. That was my wee bit of air conditioning. And thank you, legislators, for doing that. The wee lassies and laddies are really going to appreciate that. And the Scottish word for children is beden. Beden. So the bedens are going to like it too. Anyway, that's it. That's Angus for this week. And remember, everybody, let your wind gang free where'er you be. Aloha.
All right. My man, Thomas Kniss. I met you just a couple hours ago. He's been here a couple days and he's leaving tonight. What the heck? Such a nice guy, but he hasn't hung around long enough to hang out with the best guys.
All right, well, we'll have him back.
We'll have him
We're
back.
going to have him back.
He hasn't really enjoyed Hawaii.
Yeah.
But we'll get him back.
He got nice shirts.
Unfortunately, he says it is a Tommy Bahama. I have to take his word for it.
Wait,
Man.
look.
Well, you gotta look.
It's Tommy
But
Bahama.
I'm educating him on.
Come on now.
You're trying to educate him on shirts, and he comes in and he does you.
Oh, okay.
So, you know, next time we'll see what's
All
like.
right.
Anyway, so Tom, it's great to have you on the show. You're with Presidio,
Yep, thanks
and we'll
for
talk.
having
We'll talk about that in a little bit. But we always ask our guests the same question. Always when they first come on, it's like, so where did you go to school?
right.
And in Hawaii, it means high school.
Yeah.
So we'll
Where
start
you-
with
where you
high
in
school,
grad?
and then we'll talk about your university. But where did you go to high school?
Went to high school, Oxnard High School in Oxnard, California. So I'm so
Oxnard.
Oxnard.
Oh, I got to start. Remember I told the story on the boat?
Yeah, not on this live show.
So yeah, so Oxnard High School is where I went and spent 4 years there. And right out of high school, I went to Community Memorial Health System.
What was that? What's the name of the school? I'm sorry, the health system?
Community Memorial Health System in Ventura, California.
Oh, in Ventura.
Yep.
So you went right from high school into the healthcare field.
Yep.
So
Full-time student, full-time employee.
full time. So you were going. So then you went to university while you were going to.
So I spent 2 years at Oxnard Community College.
Okay.
Why spend the extra money if you don't have to? Go get your general ed out of the way at Oxnard. Got that done. Looked at local colleges, preferred a private university.
Okay.
My wife actually went to that school as well, and she worked well for her, so I figured why not, I'll try it out, and went and got my undergraduate degree and graduate degree from there.
Oh, it's cool. So why don't you shift your chair up a little bit? I like being cozy with my guests. So
Oh, yeah. Please go
So,
push in your stuff.
yeah. What made you pick healthcare? I mean, like you're in high school, and then all of a sudden, and you do a lot of tech in healthcare, and we'll talk about that as well. But I mean, what made you just go like jump into healthcare?
Well, my family had a couple of folks, my dad, my aunt, my sister all worked at the same hospital. So I was
Okay.
kind of around it. I had a lot of neighbors that worked there.
Okay.
I would do summer jobs, moving x-ray films and doing different odds and ends jobs while I was in high school, and kind of knew the environment. I thought I wanted to be a physician. As
Okay.
you go to junior and senior year in high school and you start figuring out what's it going to take.
Yeah.
I was
Yeah,
like,
did you
"Man."
have that much money?
Well, I wasn't even looking at that at that point. I was like, I didn't want to give up my 20s and most of my 30s to become a physician. It just wasn't in the cards for me.
Yeah.
So, my generation's more technology inclined, and I figured, okay, I know hospitals, I know at least an idea of what they're about. I like technology. There's got to be a way to match the two,
Okay.
and that's kind of how it came to pass.
So what did you major in at university?
So at California Lutheran, I majored in computer information systems was my undergraduate.
Okay, so you went into the IT side.
Yes.
So you went into the IT side. I went into the IT side, but there's a lot of people that never went into the IT side that are in IT now.
Correct.
Tons of
But
that.
that's why I went back, got my MBA, because you really need to understand the business units. To really be effective in IT, you need to understand what the patients need, what the nurses need, what the providers need, what the business needs to succeed financially. And
Right.
really, that's why I went back and went to the business school, so that I could really understand what their needs were and I can do my job better.
Yeah. You had a question earlier on.
The grassroots of it, because I was going, like we said earlier, what the heck does a layman person, the average Joe who needs medical attention or care, quality care, what does it benefit? How do I benefit from whatever you guys are doing in the medical field? And like you said, you just said it there, you touched it a little bit, you want to give quality care. But, unless you can elaborate more for the average Joe who's watching the program, what do you really do and how's it going to benefit
Yeah, that's
me?
a good question. So, what from a technology side, we talked about robotics and surgeries and those kinds of things, but there's all the operations side, which is
Correct.
the part that you're really specializing in.
Yeah, I think it's like you said, you want access to information, you want timely access to information. And that's one way technology can help, by making devices smart, whether it's IV pumps. So an example could be when you have her hooked up to an IV and you're getting pain medication, really the nurse has to come in and ask you, how are you feeling? Well, they
Yeah,
can
scale
actually
of 1 to
tell,
10, yeah.
but they can tell now how many times you hit the button, what's
Right.
going on. Wow, Gordon keeps hitting the button. We really
Well,
need to go see
let's
him.
not use Gordon. Gordon.
But so I mean, it's ways
It's
where
Guinness in the IV. That's the other thing.
But you can use devices like that, where you can now capture what's happening from a user interaction,
Okay.
using technology, send that to a nurse, so she's now aware of what's going on in the bed.
Okay.
It could be a smart bed, where it has a pad where if you're a fall risk, for any number of reasons,
Okay.
if you shift a certain way, again, an alert sent to a care team member saying, hey, this patient's shifting, maybe you should go send somebody to that room. They may need help going to the restroom, they may just be shifting, they may be trying to stand up.
You're right, when they're not supposed to be.
Correct. So there's things like that. I think the other side
Which is good, though. Like you said, the pain thing, because if you're a nurse, I don't know, nowadays, 10, 12, 15 patients that one nurse has to deal with, you don't want to wait
It's about
30
it's about 4 to 1.
Oh, I don't know, but back in the day, it
But
was
see, now
probably
you
like that.
now you know, 4 to 1.
Well, back then, it was more than that, probably, but then you didn't want to wait 30 minutes to get your pain, and you're good to go.
Yeah, I think the other ways technology is helping is we're really coming up on a shortage in healthcare
Yeah.
and care teams, whether it's physicians and nurses and respiratory therapists, wherever it may be. And so we have to maximize those resources to really deliver that excellent care.
Right.
And how can technology be a vehicle to that, to maximize their time and their efficiency, not be something where you've got, like what you're doing here, you've got a screen in front of you and then you've got the camera in front. You don't want that in a nurse. If you're a patient, you don't want a nurse, a screen, and then the patient.
Yeah. You want to be this way.
Exactly.
Right.
So what we try to do, and what I try to do, being formerly in healthcare for 16 years, is I try to explain to CIOs, to CNOs, to physicians, here's how we can use technology to enhance your experience, deliver better care with availability of information, but also not lose that human touch. Because when you look in healthcare nowadays, the way reimbursement's been changed, you are now reimbursed based on your quality scores. Not only how healthy you're keeping people, but how happy they are.
So talk about that quality scores.
Yeah.
You get reimbursed. You're talking about the hospital,
Correct.
or the
hospital or a physician.
physician. So they get reimbursed based on a quality score. And
Part of their reimbursement is tied to.
Is that from the patient?
So there's different metrics. So some of them are quality based from a clinical standpoint. What does your readmission rate look like? What is your hospital-acquired infections? Yes, those are scores that directly are tied to clinical quality.
Okay, so if the patient comes back, then they shouldn't be.
There's a rule that says if you're discharged and you come back within 30 days, that whole next visit is not paid.
It's not paid.
Correct.
Wow.
So again, we use technology to help that patient outreach so that the patient's taking their proper meds. How are you feeling today, Ms. Jones, or whoever it may be? Using technology to really get into the home to make sure that patient who has a chronic condition, diabetes, respiratory therapy challenges, can really be talked to and interacted with on a regular basis by these care teams.
So that's so we had a guest on our show in the past from St. Francis Healthcare System, and they're focusing on the senior care. And that's one of the things they want to do, right? They have the hub. They want to make sure that they follow up with the patient to making sure, are you taking your meds?
Yeah.
Those kinds of
Here you
things.
think about it. I've been in the hospital. I don't know if you guys have been, but the moment you're told you're going home you're like, I want to go.
Yeah.
Right.
And did you listen to the discharge instructions your nurse gave you?
No.
Did you listen to the instructions
You
your
want to
doctor
get the hell
gave
out
you?
of Dodge.
Exactly. Do you know what the meds are?
Yeah.
You're just so happy to get home that a lot of times the most important information you're going to get is how to take care of yourself when you get home.
Right.
So these patients get home, what am I supposed to take? Oh, what does the bottle say? Did the pharmacy really get the instructions correctly?
Right.
What if I feel this way? I can take 2 instead of 1. And I think that's where our case managers, and that's what St. Francis is doing,
Right.
with really taking it beyond the 4 walls of the hospital once you're discharged,
Right.
making sure that patient does what they need to stay healthy so they don't come back.
Yep. So they don't come back, and then that also then means that the costs are kept down,
Yep.
and they still have to make money. Everybody's got to realize that the healthcare providers have
Well,
to
I
make
think,
money.
You got alphabet soup in healthcare, and I
Right.
think that's where the term ACO at a very high level is essentially a payer.
ACO stands for
Accountable Care Organization.
Accountable Care Organization.
So you got a
Have you ever
payer.
heard that term before?
I heard ACL.
Yeah.
It hurts right now.
And here in Hawaii, it's unique in that a large section of the population is insured, but it's insured on the commercial side.
Okay.
And so I think that's where the benefit is that you've got your payer,
Right.
which is your insurance provider, you've got your physician,
Okay.
and you've got your hospital. Those are the 3 really pieces.
That triangle.
Is what the ACO is. And the idea is that it costs so much money a year to take care of a person.
Right.
And so the idea is you want to deliver excellent or better, better care than what you're doing,
Right.
cheaper.
Right.
And so now all 3 work together to basically drive down the cost by working together, by sharing information,
Sharing the data.
delivering your better scores to get reimbursement up,
Right.
so that when there is, say a hospital were to say $5,000 to take care of you,
Yeah.
but they do it for 2, they still share a portion of
The
that remaining
portion of that
3.
remaining.
So everybody's incentivized
Cool.
to do cheaper care, better care on a regular basis.
Affordable
Okay,
care,
yeah,
man.
affordable
That's
care,
it.
okay.
That's why I like the
hold-
Kaiser program, because
Yeah.
I'm a Kaiser guy, and they strive to help yourself.
All right,
So-
don't
so
be
Kaiser-
plugging the different.
no, I'm
different
just
items
saying.
So
here.
it's a good point, though. But Kaiser
Okay,
is,
hang on a second, you guys. I love the show, but wait, I got to pay some bills.
all right.
We got to take a little break, 1-minute break. Got to get the commercial, pay the bills, and we'll come back with Papi Chulo here and Thomas Kniss. You really are a wealth of information on healthcare from Presidio. And we'll be back in about a minute.
Aloha, I'm Kaui Lucas, host of Hawaii is My Mainland, here on Think Tech Hawaii every Friday at 3 p.m. We address issues of importance for those of us who live here on the most isolated landmass on the planet. Please come join me Fridays at 3 p.m. Mahalo.
Aloha, my name is Carl Campagna. I am the host of Think Tech Hawaii's Education Movers, Shakers, and Reformers. You can see our show every Wednesday at noon at 12 p.m. on thinktechhawaii.com, as well as visiting YouTube and finding the link for the show there. The show is also aired on OC16. We look forward to seeing you on the show. We have many wonderful guests, including Joan Husted, Corey Rosenlee, where we talk about the very important issues of education for our keiki. We look forward to seeing you there. Mahalo.
Aloha, how you doing? Welcome to Hibachi Talk. Gordo the Texar here with Papi Chulo and Thomas Kniss. We're here talking about Presidio and healthcare and those kinds of things. So you had a question you were going to ask?
Presidio, never heard of it. What is Presidio? And you represent Presidio, but I always thought that was something in California. What is Presidio?
We hear that as you guys from San Francisco, everybody asks that question. But Presidio is a nationwide systems integrator, roughly a $2.8 billion company.
2.8 billion.
Yeah.
Billion.
And what separates us from everybody else is that, yes, we're a nationwide company, but we have over 60 offices. And so we really understand that we need to address technology issues in communities. And so that's why we have so many offices. That's what we're doing here in Hawaii.
Right, you're coming into Hawaii now.
Is we want to make sure that we understand those unique challenges to every community, every state, every county, whatever it may be.
Right.
Which is good because, like you said, you're going all around the country trying to be everywhere. I never heard of you guys before. I'm in Hawaii. I never heard of it.
The
But good
beauty
for you
of it
if you want to come
is
here.
if I'm here, talking to folks in here in Hawaii and they have a unique challenge, I can give them insight to major institutions in California, in Texas, in New York, in Florida, whatever it may be, so you can get some of those lessons learned. And the beauty is we have roughly 2,800 employees, most of them engineers, and so if you have a unique challenge and you can't get here on the island, we can make a phone call and figure out where is that resource. They can come in via telepresence or the web to help out with the challenge.
Right, can we use technology?
Or they can come out here if need be, and I think that's the beauty of it, is that local touch and national reach.
So one of the things, and the challenge we've talked about in Hawaii, and we have it we had the conversation today with someone, resources, technology resources. Part of the reasons we have this show is we want more people to get into the tech industry, and there's all kinds of ways, healthcare, legal, whatever, but it's hard to get resources. So what we have to be able to do then is we have to go and then find ways of tapping the resources that are around there. You've got a network of healthcare connections all over the country. So if someone wants to put in a new electronic medical record system, you're agnostic, you don't care.
Correct.
But you've got experts that are all around the country that know the pros and cons, the best, the worst of each one of the providers of those services.
Yeah, so we can go based on that customer base and get some lessons learned.
Right.
And then what we can do is apply it for you guys. We can explain, here's what's going on, here's what we've seen across the country. We don't try to steer you in any given direction. We simply try to show you what's out there and move forward.
So now do you connect, so you could connect a CIO from a facility here in Hawaii and connect them with a CIO in a hospital that anywhere in the country?
That happens a lot. So you would say, what are the metrics that you want to talk to? Do you want to talk to a community hospital?
Okay.
Who's going to have more of a hands-on approach? Or do you want to talk to a large IDN that's
What's an IDN?
Integrated Delivery Network. So
Okay.
essentially it's a very, very large, it's like
Hawaii Pacific Health?
Hawaii Pacific, Queens, they're IDNs because
Okay.
they really have a large network to deliver care, both acute and ambulatory, so they can do that. So depending on what you want to talk about, do you want to talk about Epic? Do you want to talk about how to enhance a call center for patient outreach? Do you want to talk about center technology, a Cisco switch or a Cisco server? You let me know what you're looking for, and then kind of the size of the institution, and we make some phone calls. Some of them are customers, some aren't.
Right.
Healthcare, even though it's a large business, is a small community, and we try to connect you guys in.
Oh, tell me about it. I mean, you and I are both ex-healthcare CIOs, and we know how complicated and ever-changing that industry is.
Do you have any affiliation with the federal government? Because they're reaching out to all their civilians, military personnel with medical records, appointments, and everything else.
So Presidio has a federal practice based out of our Maryland office, and we do assist those different facilities.
Because I get these calls, hey, if you're the so-and-so person or this person, this social security number, please press 1 to validate your appointment at the occupational health clinic or Tripler Medical Center. So I was just wondering if you guys are affiliated with the military or what have you.
Yeah, we have an outstanding federal practice. So.
Oh, cool. I didn't know that.
Yeah.
So, and that's, again, we want more talent here in Hawaii, but we have to be practical and
So
realistic.
Our practice goes federal government, large IDN, small community-based hospitals, rural healthcare, because really they all have unique challenges, and we can certainly help.
But you're not just in healthcare. I mean,
Not Presidio, no. Presidio is across verticals, retail, finance,
government,
government, legal.
But
My responsibility is strictly healthcare.
You're the healthcare guru.
Yeah, I lead our healthcare practice. So what I do is I essentially bridge the gap between our technology engineers
Okay.
and the healthcare team. So
any way the Presidio benefits the veterans with the ongoing problems right now with the VA, or is there, or not yet?
at times if the VA decides to engage us and our engineers, we can certainly help.
You can probably be a big help.
Yep. And someone's just got to make a call.
Yeah. Just reach out, I guess.
Yeah. So, but it's like there's all kinds of ways to look at how you handle the healthcare field. What do you see some of the biggest changes that are happening now, like in the recent 2 or 3 years? That's
Well, I think the big thing in the news is security.
Okay, still security.
Security is still big. I don't know what the numbers are, if it's $50 or $20 or $100.
Yeah, I think 55 was what I was
It's
last
probably a
read.
good average number.
Yeah.
The deal is that if you steal credit card information, healthcare information is almost 200x in value.
Yeah.
Because you can do so much. Where a credit card, you can go use it, go buy it, and then they're going to shut it down. Where with healthcare information, one, they can use as leverage if there's some information you don't want to get out. And the other thing is you can really truly steal somebody's identity pretty easily with their healthcare information.
Yeah.
So, at Presidio, we certainly have a practice that can help with that. And there's really two ways to it. You hear, okay, I need firewalls and different things to keep people out, but a lot of times it's an education thing,
Right.
I mean, there's a lot of folks that are really smart trying to do some really bad things, which you got to realize that you're probably going to get hacked. But you want to do everything you can to make sure that it doesn't happen, or if it does happen, you can react quickly.
Yeah.
So you don't get, there's something like the ransomware attacks in California don't hit you. You can have tools in your network that, if you notice an anomaly, you can shut that device down.
Yeah. What was that hospital? I think just a couple of months ago.
I know it was in Los Angeles.
It was Los Angeles. Yeah, we had it on a news segment on the show that got nailed on the ransomware.
Yeah,
and it was
ways,
Bitcoin they had to pay.
And I think that's where Presidio can help you adjust to it, because there's times where you really can't stop it, but how do you recover from it? How do you just cut it off and go back to 4 hours to where life used to be?
But this is off the beaten path, buddy. We're talking medical and everything else. We're just fine and dandy to benefit the public and general public. But when I go to the local theater here to watch a premiere showing, and they scan my confidential IDs, a driver license, passport, or what have you, scan it. I said, the federal government can get hacked. What are you going to do to the general public to prevent that from happening?
Well, I think that's just it.
And you're just a theater.
Correct. So
So you can go in there
and that's why I go back to, I think everybody at some point or another, whether it's a mistake, whether it's an education issue, whether it's somebody actually getting in your network maliciously, you're going to get hacked. And that's why I tell CIOs when I talk, like, listen, what you want to make sure you do is that you're best prepared to respond.
Right. So when example, when I was with the city, we put in this massive unified communication system. It had to do with public safety, infrastructure, and whatever. We can put in all of that network infrastructure, but then there's the security layer. Is there enough expertise in town to help with that? So we engage someone like a Presidio to come in and tell, okay, from a security standpoint, here's the next things you need to do.
We've done things where you send an email blast. It looks really slick. It looks like it's coming from a Kaiser or whatever it may be.
Oh, yeah.
And the organization's aware of what we're going to do, and we track how many people opened it, how many people clicked on it. Because really, a lot of times when ransomware and those things happen, it's because a user is not trying to make a mistake, but they do.
You're right.
Or we do physical walkthroughs. You've got a lot of facilities that have badges to get in and out of buildings.
Right.
You get a tailgater come through and can do certain things and sit down at a PC that they look like. They put a stethoscope around their neck and they look like a doctor.
And they look like a doc. So Andrew, who's the security guy that sits, that you guys share the seat. That's his expertise in that area, in that access controls, monitoring.
When we talk security, it's everything. It's physical security, it's policy based, it's education, and it's the firewalls and those type of things.
Well, like I said earlier on the news, 50% were criminal attacks on healthcare, and the other 50% were human errors.
I would guess that number is a little bit different. I would say it's probably more human error.
More human errors. Wow.
But in my arena, we got things in place that we can handle the situation right then and there. Like somebody comes in, boom, bad boy, anywhere across the nation, boom, red flags.
Yeah, you can scan them through your
NCR,
databases, whatever
which
are.
is national, and we have the law enforcement background to deal with it immediately. Where if I go to the theater and I'm a pedophile or whatever, I'm still going to go watch the movie.
Well, you got to remember, you can see the person.
Yeah.
In cybersecurity, they could be in any country around the world.
Yeah, they can
you don't
be
see
anywhere.
them. And these folks are highly skilled, highly educated. Where let's be honest, some of those criminals they're the reason that
Yeah.
they're caught, right? I mean, these guys are really, really smart.
Yeah, they really know
Yeah,
what they're doing.
they know what they're
well, and so the Fed's got a bunch of programs going now where they want you to try to hack into their systems.
A
And
lot
these
of
systems-
those-
today.
Yeah, a lot of them do. You know, a lot of the folks that make firewalls, they do annual things and saying, hey, if you can help us expose vulnerabilities that we can fix.
Yeah, so some of the ones, well, the big firewall manufacturers and so on, they'll actually put out a self-imposed bounty on themselves, right? They'll say, if you can get in and hack our systems, we're going to give you $1 million or something like that.
Yeah, there's random ones that come
In all the time. So the thing we talked about earlier about all this, the data, this commonality of data,
So
you
that's-
must still be running into this silo stuff,
So,
seeing it.
so the nice thing about that is a couple years ago with the this AARA, American Recovery and Rehabilitation Act, or whatever it stands for, there was a piece for it that had meaningful use. And I mean, you may-
meaningful use.
Yeah, so there's different stages, stage 1, stage 2, stage 3. And really what it was is the government incentivized physicians and hospitals to basically modernize their electronic medical records.
Okay.
And parts of those different phases included interoperability, where you can now have a universal file that you can send between systems, whether you're running Epic or Meditech, whatever your software system
Whatever
may be,
systems are.
that you can then now transfer data so that a physician can have access to your history. So if you're on vacation here in Hawaii,
Right.
and whatever happens, found unconscious, what have you, they figure out who you are, you can then make a request to say, I need Thomas's records. And they can send that CCD, as opposed to the old way of going, where it was a paper fax, you've got to scan it in, or if you have this electronic version, it can trend all your data for you and your physician can see what's going on.
So what you're talking about, so we think about, we kind of summarizing, pulling this thing together, initially we were talking about all the different, medical tracking from the direct patient care, the IVs, all of the things that are happening, the smart beds, the
There's
internet,
so
of
many
everything,
things.
all of those things happening. Then you step to the side, and then you've got all the financial aspects and all the things that are happening there.
With outreach,
With
contact
outreach.
center.
And then you got there about, again, the revenue streams, cost control, and all those kinds of things starting on those systems.
Yep.
So talk about that's if you want to get into an industry to give you all kinds of opportunity, healthcare's got to be one of the best.
Well, healthcare, I think, but just being in technology in general, our engineers work across platforms. They're not just healthcare engineers.
Okay.
They work in finance, they work in retail, they work in law firms. The idea is that there's a lot of lessons learned that'll translate across verticals. That's my job, is to really translate what healthcare means to them.
Right, because as an engineer, you could walk in there and say, I know such and such, but then as it applies to healthcare,
Yeah, you set up a phone system, great, we'll set up a phone system, you can pick it up and dial, but how do you make that phone system work for the care team?
right, and how you integrate it with your nurse call system, if that's what
Exactly.
you want to do, or how you integrate it with your call center.
Yeah, you hit a button on your bed, and now it calls a nurse on your phone, and she can direct access to what your
And right
concern
there.
may be.
And then that data is then tracked
Yep.
and put into a database to help with the number of nurses per patient.
Actually can help you with
Quality
your
control.
quality score. So, if a patient's hitting a button 6 times and the nurse is just too busy to get to it,
That means you don't have
when
enough.
you go home, what are you going to put for how good she did?
Yeah, hello.
She may be really busy dealing with a critical issue. So that's why these things are important. So then it lets hospital leadership say,
Okay.
maybe we need to expand some staffing in certain
Yeah.
areas.
Okay, cool. Believe it or not,
Oh,
we
that's
just
time.
burned through 45 minutes of the show.
Well, I'll be
So-
back in
Hana
about a
ho,
month.
hana
We'll be
ho.
back about
Hana ho.
We got a lot to talk about healthcare. I learned a lot on this, and I hope
Right,
you
so I
did
did
too.
too.
Hope everybody else did too. Our guests do not go away unrewarded. This is the autograph solo cup.
All right.
You've got number 68 in the series. I don't want to see this thing being sold up on eBay. This is yours. One bronze and mounted on this shelf.
What's it
Put
worth?
it,
I might
yeah,
have to
put, it
well,
next, put it next to your Emmy or your Tony or whatever you get down the road.
Yeah. So
Yeah.
anyway,
Businessman of the Year.
Businessman of the Year. Anyway, Thomas Kniss from Presidio, great to have you here.
Papi Chulo.
Great to have you in the house. Hey, Ira McForklift, happy birthday there, bud. So enjoy your retirement. So thank Nick and thank Zuri for once again helping us get us through this. And as we say at the end of every show, 1, 2, 3.
How you doing?